Okay, Callie. Yeah, we can start whenever you're ready.
Cool. Sounds great. Thanks. Hey y'all, I'm Callie. Lovely to get to chat with you all this evening. Thanks for having me. And tonight we're going to chat about backcountry behavioral health, and talk a little bit about how behavioral health is really intersecting with wilderness medicine. And the main takeaway point of tonight is just really how much there is to learn about behavioral health, right, within the spectrum of backcountry behavioral health. I think it's been super cool the last few years where we've started to see like psych first aid and some stress and injury pieces come into the work. But there's so much more than that. And so we're going to explore a little bit of that. So, with that, let's see. Oh, now it's going to jump, of course, a bunch. I like to just say welcome, to get us centered for the evening. I like to always do a little activity where spend a minute stretching and either on a piece of paper or on a notepad on your phone, just write down like all of the to-dos that are running through your head, all the other things you're thinking about. Make sure you're like nice and comfy. Like need to stretch each different way, so that we can be here for the next hour together. So I'll give everybody a minute to do that, and just get comfy. Put all the to-dos that you have that you've been like running from whatever you just came to and whatever you're going to go to next. All right, and we'll do it about 10 more seconds and then we'll come back together. Great. These are two tools that I like to use actually quite a bit when I'm working with folks. They're just really great centering activities. So one thing that can happen right with behavioral health is we're all busy. We've all got a lot going on. And just taking a moment to like get into your body, move, stretch, right, can really help center us into what we're doing. As well as when we have like a million things running through our brains, right? Like maybe we just got off shift, maybe we're about to go to shift, right? Or there's like seven other things we're doing tonight. Having folks write it down or like put it on a phone note, can be a really powerful way to like help reduce some of the overwhelm that's happening. So yeah, I always like to start us off that way. And just like to give you all that tool as well is a great way to like, hey, if folks having a reaction, right, if something's happening for them, can be a great way to help like center. Okay, we're here, we're all together. And with that, I'm super excited to talk with you all tonight. I'm Callie. I am a behavioral health clinician licensed in Oregon and Washington. I worked in emergency departments, the VA, as well as lots of different outpatient settings, as well as public health work, all the way to one-on-one clinical care. And I love to go outside. I play outside a ton. Been doing outdoor guiding and leading for now over 20 years, and have been part of like the wilderness medicine woofer side of things as well for a really long time. And because of that, I started working on kind of combining these two, right? Because so much of this conversation was missing. That all being said, I am here tonight to share some info with you all, but I am not your provider and I am not your lawyer. So if you have like actual specific questions for those two pieces, please talk to your lawyers and your providers. Because they are the best resource for you in that. And if you need recommendations, can always share some. So when we talk about backcountry behavioral health, I kind of like to break it into like three big categories. Right, as I mentioned, we like to talk about like psych first aid, stress injury, and these are really important, but they are really just a piece of backcountry behavioral health. So the first piece that I like to call is understanding the terrain. And this is really what we think about when we think about understanding behavior, right? Understanding what is behavior, why do we have the behaviors we do, why do people do the things that they do, right? Why do people have the reactions that they do? And so understanding where behavior comes from is really central to being able to understand what's happening, folks. And not just folks, but also for ourselves, right? Because unlike other physical medicines, right? Sometimes, yes, we have a femur fracture and our patient has a femur fracture, but more often than not, just our patient has a femur fracture, right? Whereas in behavioral health, our behavioral health is always at play when a behavioral health or other medicine incident is happening. And so ourselves are also really important in that. So understanding the behavior, right? How it comes, what that's like, is the first step, right? Then the second component is really mapping the mind. And this is where we talk about, yeah, what are those reactions, right? What are the behaviors we see as a result of our biology and lived experiences? And, right, when do we get to the space where they are conditions, or as our DSM likes to call them, disorders, right? Like when they become clusters that really impact us, right, and have impacting on our functioning. And, right, within that, right, what's the difference between bipolar and mania, right? What's the difference between ADHD and psychosis, right? Those different pieces is really that second part of backcountry behavioral health and behavioral health in general. And then the third piece is then like, hey, what do we do, right? When we are seeing these different symptoms. And why psych first aid is like a great, really acute crisis response, there's actually a lot more to it, right? There's things from like before we even go out in the backcountry of just like understanding preparation, all of those pieces, all the way through management, right? Because often folks are on medications or need to do specific things to help manage their behavioral health. Two, then, yeah, what do we do in those crisis situations? What counts as a crisis? And then where it becomes really important with behavioral health is also like, what is the postvention, right? So, what are we doing when we get back? What does that look like? And that depends, right? If it's, oh, someone was nervous on the side of a cliff, or if someone died, right? Those are very different postvention interventions, but they're also important. And so that's a really last piece that I like to really stress within this is that it's more than just the acute crisis for us when we're in the backcountry with behavioral health. There's really that spectrum. And so tonight we're going to kind of go into all three of those categories at a very high level. And this whole piece is to just give you all the sense of like, hey, when we think about backcountry behavioral health, right, what are all the components that we're thinking about? Giving you basic information about each of them, but also really saying like, hey, there's a lot more to learn, right? So that you all have the tools and know like, hey, I need to go understand this piece better or that piece better to feel competent and comfortable dealing with this stuff for yourself and for others. Um, I like to think of this as our behavioral health conditions, right? So when we think about behavioral health conditions, there's a number of different pieces that go into that. We start with our biology, our evolution, right? How biology works really plays into this. Our evolution, right? What has happened to humans over the course of time really dictates why we do what we do. This is then impacted by epigenetics and genes, and that shows up over and over. That then meets us with our brain cortexes. So, how our brain is structured really matters, right? We can see that between things like ADHD, but also, right, like TBIs and other like acute intoxication, right? What's happening to our brain structure matters. That then combines with our lived experiences, right? What we've experienced in this world directly impacts what our behaviors and how our reactions show up. And that's all, of course, constantly interacting with the social context, right? So we live in a social context. And understanding that's really important and understanding why folks do what they do. Those four are always kind of like informing each other, right? And leading us to our behavioral health symptoms, right? So these are things from anxiety to aggression, irritability to going for a run every day because we know that's good for us, right? And it's really important for us to understand our behavioral health symptoms then to figure out, like, right, what are our best healing treatment and resiliency options? And these things, of course, are constantly informing each other. So, with all of these pieces, that's like a big overview of where we're going tonight. So, to start, we're going to go back to the basics of biology. My favorite Bio 101 professor put food, sex, death on the whiteboard when we first showed up in Bio 101 as freshmen in college. Um, and basically, what he highlighted is that, right, all living creatures come back to these three things, right? All living creatures need some type of food, energy. That obviously looks different. Sex being reproduction, right? All living creatures reproduce. That looks very different across the things, right? Some just simply split in two. Others need partners, right? Others need seeds. And then death, right? We're all holding off death as long as possible to do the first two things. Sometimes that is a matter of minutes. Other times, right, that's thousands of years. But this is really critical when we think about why we do what we do, right? Because a lot of our like nervous system and our body responds to these things. Humans is especially important because we learned very quickly, right, in our evolutionary history that we are really based in our social connection. So social connection helps us get food, right? It helps us reproduce. It protects our babies better, and it helps us keep ourselves safe. So because of this, a lot of our responses and our behaviors and our emotions stem from this system. which is where we get the social context, right? Because what folks figured out is that if you control the group, right, you are more likely to get food, sex, death, right? You are more likely to prevent death. But creating a hierarchy within the human condition, right, makes it so that, like, hey, if you're so worried about being bad or worse, right, then I can control you by making you the problem, by say something that you are not capable of changing, and that allows me to control you. And that is where we see this, and we think evolutionarily, right, why we started to see these social hierarchies that we have within our communities. This now becomes really important because it absolutely impacts, right, the way we all interact with each other. Which becomes really important when we think about our behaviors, when we think about our reactions, when we think about our responses. When we think about, right, our social context and the good and bad, there's lots of different places that this shows up, right? We think about things from race, we think about things like wealth, we think about things like your cortex, right? What we call our normative cortex versus our ADHD cortex versus our autistic cortex, right? Those have a hierarchy. Despite, right, a lot of science that shows us we very purposely develop different types of cortexes for different reasons. But of course, we have our hierarchy within this society that we live in, and that creates, right, a lot of hardship for folks and a lot of privilege for other folks. We also know, if you all haven't met Kimberly Crenshaw or had a chance to listen to her work, highly recommend it. But she really coined the term, right, intersectionality. And that's that all of us are living in an intersectional of this piece, right? So we may be white and we may be Jewish, but we also may have an autistic cortex, right? And so that can put us at multiple different levels. We also may be non-binary Muslim and have a personality disorder, right? And that's going to put us at a very different level and be treated very differently in our society. That becomes really important, right, when we think about that social connection that we're all trying to have because of, right, our basic biological instincts. Within that, right, we evolved with a communication system, right? That's when we think about, like, hey, what is behavior? Why are we talking about behavioral health versus just mental health? The reason is because, right, mental health is part of behavioral health. But often, right, all of our behaviors stem from, like, what's happening between our brain and nervous system connection, right? So things like violence, things like aggression, things like drinking substances, things like going for a run are often reactions, right, to how our body and brain are working together and feeling. And so when we think about that, right, we're driven by this idea that our emotions and our feelings, right, what feels good, what feels bad, what creates shame, right, what creates guilt, what makes us feel good about ourselves, right, then stems and leads us to our behaviors. Whatever our behavior is has consequences, right? Some of those are positive, right? We go running every day, we feel better. Great, we're going to keep doing that. That makes those happy endorphins happen. I learn, oh, I like feeling good. That reinforces that behavior, right? Now, simultaneously, if I do that and I have a negative consequence because I have a torn labrum and my hip really hurts every time I go running, right? I'm going to get that pain, and that's going to have that feeling of pain that's going to tell me, oh, I don't want to do that activity. Same thing, right, can happen in terms of any behavioral health symptom, right? So, hey, I'm feeling scared. If I get really big and start screaming at people, right? Maybe as a black woman, I get labeled aggressive and mean, but say as a cis white dude, I might get celebrated, right? And said, yeah, you can come continue to be. We're going to listen to you, right? That's where that social context comes in, but also, right, how consequences really help train us into, like, what our responses become, and those patterns shape us over time. So, that basic biology, right, then intersects with our brain structures. And yeah, we evolved to have different brain structures. And our brain structures have different pieces to them, right? And depending on how those are intersecting with us and our evolution, right, that really helps how we show up in the world. So we think about everything from, like, long-term, like lifelong conditions, right? Things like cortexes, things like TBIs that happen like really closely post-birth, developmental differences, right? So things like Down syndrome, schizophrenia, long-term chemical interactions, right? So folks that were exposed to chemicals or substances in the womb, Alzheimer's, dementia can be long-term pieces, right? Or long-term stress, abuse, traumatic impacts, right? We see that over time. That can really change our brain structure. We can also get, like, really short-term, right, occurring conditions that also really impact our brain structure and are going to impact our behavior, right? Things like poisoning, head trauma, acute intoxication, brain tumors, strokes and aneurysms, concussions and TBIs, and, right, fear. like being really scared, really floods our brains with chemicals. And that can start to change those structures. So, right, these are some examples of like how our brains look different, right? So it's pretty cool now. We have some cool imaging on things like schizophrenia, and we can really actually start to see the differences of like how the brain is really structured for folks that experience schizophrenia. This is not true for all like conditions we call in our like mental psych world, but schizophrenia is one of them, right? That we really can see that difference. Um, we also, though, see these differences, right, when we look at lived experiences and genes. So, different folks' genes and lived experiences here on the left side, right, can show us a whole bunch of different things. Things from like migraines to MS, that it's like active versus inactive, to leukemias, to many different pieces, right? Lymphomas, all of these can dramatically change the structure of our brain. And based on how our brain is structured, right, impacts how we are responding, reacting, what emotions we get, right, what feelings we get, which then again, right, drives our behaviors, drives our choices. We also have really started in the last few years to get some really cool stuff on lived experiences and the social context, right? And so how much stress is changing our brains. So up here on the top is this lit up scan of a brain as a Romanian infant and who was an orphan. And they scanned this kiddo's brain a number of different times. And the first brain shows their healthy brain when they were really young, and then the one on the right shows after years of abuse. And you can just see, right, the difference in the amount of gray matter that's been created by that abuse, right? So it's literally changing folks' structure of brain. We see this with PTSD, we see this with domestic violence, right? We can actually physically see the differences that these like behaviors and reactions, right, have to people in their brains. When we talk about like the social context, right, things like racism, sexism, all the isms, right, these aren't just political, right? These are things that are creating really impacts on people's health and certainly on their behavioral health. And this bottom picture here is a study that was just published this last year of over 15,000 brains of women that they did in Europe. And this study, right, showed that the only piece that these folks all had in common was just experiencing sexism. And what all of the images showed was just how much sexism created stress on the brains and created more gray matter over the course of it's like 20 to 25 years per study they were doing. So, right, like all of this goes to show us that like our structure is constantly being informed by those other pieces, as well as what we're born with, right? Or what happens to us, say, for, climbing and we get hit by a chunk of ice falling off Mount Hood. So within that, right, that's where we combine this then with our lived experiences. Our lived experiences, right, are dynamic. They're what's happening to us all the time and what happens to us over time, right? So it can be physical events, it can be trauma, right? It can be long-term substance use and chemical exposure. It can even be short-term, right? Some folks try a substance once and it really impacts them forever, right? Trauma and distress, right, can be on a continuum, and those can be anything from like physical events to emotional events, as well as just like poverty, right? Lack of resources, right? Having the stress of like not being able to have what you need, slash living in a system, right, that tells you you're not good enough, you're too much, you're too aggressive, you're too fill in the blank. And right, that's really where we come into that structural context and the oppression, right? So dealing with supremacy structures, right? And how that creates stress on the brain and on the body, and right, how our bodies respond to that. And just surviving in unsupported structures, right? So if folks don't feel like they have care, they don't have that community for whatever reason, those pieces all really come together when we look at people's behavioral health. So when we talk about the outdoors, right? We're all bringing everything we have behind us. Plus, right, backcountry behavioral health is like always actively happening in real time every time we're out there, right? Because things are changing, right? Things can be stressful, things can be fearful, right? Things can be unknown, things can change really quickly, right? Like we are sometimes in new environments, right? Talking about Mount Hood, right? A lot of people climbed it on Saturday and there was a lot of ice fall, right? Because it got so warm so quickly. So you can have climbed it a lot of times, and if you were just in the wrong spot at the wrong time, right? Things can get scary really quickly. So, right, when we combine all of those pieces together, then we get to this piece, right? That is sort of like the understanding basics of our behavioral health. Obviously, that was a very high overview of it, but right, diving into each of those pieces and really understanding how they connect is really important in understanding, right, why do people do what they do? Because that's right where we get to these behavioral health symptoms. And symptoms can be healthy or unhealthy, right? Going for runs every day, eating well, engaging with your social community, healthy things. Unhealthy things can be things like anxiety and panic attacks, right? Depression, substance use, violence and aggression, psychosis, suicidal behaviors, self harm behaviors, risk taking behaviors. And this is one I really like to point out in the outdoors, especially, is because we love to reward risk. Like, right? Who sent the biggest jump, right? Who went off the greatest cliff? Who paddled the biggest whitewater, right? Like, we're constantly taking risks. That's half the fun. And, right, it can actually be a really, like, pretty red flag symptom, right, that somebody's not doing well. And they're coping or compensating for other things in their life, right? Insomnia, hypersomnia, other examples of that. Now, when we think about symptoms, they're going to happen one-offs, right? So, like, hey, here's this behavior we're seeing from this person. Here's this emotion, feeling that keeps coming up for them, and it's impacting how they function. What we see then is those become clusters, right? So we see these same patterns kind of come together, and that's when we go to lead to what we call our disorders, right? That's when we get to our space where we have conditions, right? So when we think about those, when we see the same patterns, like that's when we start to say, like, oh yeah, these are our criteria, right, for PTSD versus these are our criteria for complex trauma, right? Versus which are some of our stress disorders. We also get personality disorders, which, to be fair, there's some like discussion now about, right, if those are just trauma responses or if those are actually separate. I will be surprised if they're not just trauma responses soon. But we'll see what happens. Psychotic disorders, right? So folks that experience that paranoia, that detach from tangible reality. Mood disorders, right? Those ones we're more familiar with often on the like depression and anxiety side. But, right, we also go in there and think about bipolar. But there's differences, right, between what is bipolar versus what is ADHD. Addiction disorders, emotional regulation disorders, and sleep and food disorders, right? So this is where we talk about eating disorders. This is where we talk about body image stuff, right? Identity pieces also come in here. I say this to say, right, there are a lot of different conditions that folks can have. And spending some time, right, really getting to understand, yeah, like what are healthy behaviors, what are unhealthy? And caveat on that, right, it's a spectrum. It's not black and white, right? We live in a world of sparkly rainbow. And like some of a lot of things is great, and too much of anything tends to be unhealthy, right? Same on the flip side, right? A little bit of it can be great. And, right, we live in that nuance. And so that's really important when we think about these. And, right, we get to that conditioned space when we start to see those patterns over time. And so thinking about that, right, becomes really important as we think about, like, hey, I understand what a femur fracture is, right? Do I understand what bipolar is? And so spending time, right, going in and getting to know some of these can be really impactful, right? For ourselves, but also for the people that we're out there with. And no, we don't have to know it maybe as much as I do, where I have to go into the ED every day or with my patients, but, right, we are able to have a much deeper level of that. And, right, in the backcountry, all of these things come together, right? So folks are coming with all of their different lived experiences and the symptoms and conditions, right, that are showing up for them. Some folks are actively working on it, right? They're engaged with clinical supports and care. Other folks, right, will tell you this isn't even real. They're all out there. And there's a lot of the folks out there, right, that'll tell you it's not even real, which is fine. But often, right, when things are happening for them, we're still out there supporting them. And so this is where, right, then we get to that final section, right, around like navigating the storm, right? What do we do when we do encounter all these different pieces? And again, this is a high level overview and there's so much more to go into. But, right, this is when we think about what are our tools. And I like to think about like this is our behavioral health management, right? So pretty similar to when we think about crisis management, when we think about just any sort of problem management, right? We think we can break it out into a few steps, right? We can do prevention and preparation, right? What do we do even before we go? What are our tools there? Then we have our intervention, right? Our incident management, our field treatment. What are we doing when we're in the field? And this is like a spectrum too, right? From just like keeping people at baseline to, oh, we're in high crisis space. And then, right, when we come back, right, post field treatment And postvention, right? What are we doing? How are we supporting people? How are we connecting them to care? What does that care look like depending on what they need and who they are? So within this, I like to use this model, right? Of like in our prevention and preparation space to think about things from like health promotion, right? Like what is the culture we're building around this? What are our prevention tools, right? What are we doing to help prevent and make sure, right, folks are in their best spaces before they go out in the outdoors regarding their behavioral health? And that's for ourselves too, right? What are we doing to prepare, right? So if we are going out, like, hey, do we have the right medications with us? Hey, do we know what those medications do? Do we know how they interact with, say, things like epi? Very, very important, right? Because a lot of psych meds have big impacts, right? Because they are vasodilators. And so how they impact different things can be really important when we go outside. Um, and especially when we're using other first aid pieces. So being prepared for that, right? And also thinking about things like harm reduction, right? We're not going to solve everything out there. And the number of times, right, I have stumbled upon somebody. I'm a big whitewater kayaker. If you hadn't gotten that by some of these photos, on the river who was overdosing, that was not a river person, but we just like stumbled upon them or their body. I think I'm at 10 now. Especially down here in the gorge on the Wind River, we get a lot. And so, yeah, I have naltrexone in my boat with me all the time, right? And so having that and having those harm reduction techniques with us can also be really important. So thinking about those pieces as well, right? And then we go to the incident management and the field treatment, right? So what is our maintenance, right? So are people taking their meds, right? Are people taking the breaks, right? Eating the protein, getting the sleep they need, you know, getting the like moral support they need. That can look a lot of different ways, but right, how are we helping people maintain and how are we maintaining ourselves? Also thinking about, right, like what is our field treatment? So, right, like, hey, what do we need to do to improvise things when, you know, oh, we're starting to show signs of shifts, right? Then thinking about that early intervention. And then, of course, our crisis continuum of like as things get to that really acute place. But, right, most of the time, just like with any of our other things, we're talking about the little hotspot, right? We're talking about more of this like maintenance field treatment, early intervention than we are getting actually to full crisis. Of course, it does happen sometimes, though. So we want to be comfy across that. And then, right, yeah, thinking about what happens when we come back, right? So, what is that post field treatment? What is our clinical care? Do you actually know what clinical care is option like possible, right? A lot of folks don't even understand, right? What does behavioral health care look like? So, knowing that so that you can suggest it to a friend or somebody you're outside with or somebody that you're just helping rescue, right? Can be really impactful, right? And then postvention, right? How are we working to kind of come back up here and change that culture so people don't feel as much shame or don't reinforce abusive behaviors, right? Or don't like belittle and continue to be racist. Obviously, we got a long way to go, but we can do it. And then, right, that's when we think about that long-term recovery. So within that, one of the tools I like to give you all is just as an example of this is incident management. This is when we often talk about like psych first aid, right? Our psychological first aid, PFA. Another one that's really commonly being used these days is mental health first aid, right? These actually, so I nerded out on this because I was really curious where our crisis responses were coming from. Because in more of the clinical settings, like John Hopkins came up with Rapid, for those of you that may be familiar with that tool, that gets used more in like emergency settings. Look, Listen, Link is what the World Health Organization developed. And the Hobfeld 5 elements is another one of those more clinical settings that gets used a lot with like first responders and paramedics. Um, and I was really curious, like, hey, what's the science behind all of these? Turns out the science behind all of these is biceps and Costco, which is our military. So as with a lot of medicine, the money is coming right through military. And one of our big behavioral health pieces was a big military study that they did around Vietnam, Iraq, and Afghanistan soldiers and PTSD, and how to keep soldiers engaged in fighting and being soldiers when they were out in the field witnessing, right? Bombs going off, kids getting blown up, all the horrific things that happen out there. And so what this study was based off, and it says it at the very top of it, is the number one goal is to continue mission and to make sure that the mission is successful. So, right, this study and these science is all based around making sure that people keep going, right? Which, yes, if you're in an active avalanche, yeah, you need to get folks to the space where like the avalanche is no longer happening. But, right, once we are not in an active, like, hey, we are going to physically die if we are not in this moment, right? Or we are not in this spot, we're not always in the right, like, oh, we just have to keep going. We are in the urgency of the mission above all else, right? And so I just like to give that tidbit to folks of like, hey, think about the protocol you're using, whichever one you end up using, and make sure, right, that it's something that really is focused on the people you're with, right? Yes, we have a tier of safety that's super important. But especially when we're outside, right? Most of the time, we actually do have some time. And so, urgency, mission success, we don't need to always just power through things, right? We can actually do some things that, yeah, may take 10 minutes, but, right, they really improve behavioral health outcomes for everybody. Um, and so basically what I did here was I overlaid this and then I overlaid it with wilderness medicine. So like if any of you have taken like a WFR course, right? So the wilderness first responder, this is what they're looking at, right? So their scene size up, that protocol is overlaid here in this final. And basically what I came up with is I want a term that's really easy to remember, that folks, right, because we have so many acronyms in healthcare. So I like to tell myself root, because it's also at the end of the day for behavioral health, the most important thing is to just root things, right? Calm things, ground things, whatever it is for you that helps remember that. If you forget and don't know anything else about what's happening, right, when anything behavioral is happening, right? We are just trying to lower it, right? We are just trying to help reduce, right? We want distress to come down. We want moods to come down. We want panic to come down, right? So I like to think about it, if nothing else, like I'm just rooting, right? That also can go into like, right, the details of recognizing, right, what is happening. This is where we like understand what might be happening for them, who they are, right? Observing, assessing what we've got going, what's happening, where are we, what can we do? Orienting, this is when we really think about, yeah, what are we doing to stabilize to that, to anchor to that? And then we're taking action, right? Like, okay, what are the steps that we can really take to support this? And this is going to depend, right? I think the most important piece within all of this, right, is understand one, where your science is coming from. And two, does that science make sense for the space that you're in? And then three, right, what is something you're actually going to remember? Because, like, for me, I'm not going to remember all of the different pieces of psychological first aid or even the Hobfell 5 because I just have too many acronyms, especially after being in the ED all day, right? But I can remember a word that tells me generally what to do. So use one and find one that works best for you, the space you're in, and right, like helps you remember, hey, if nothing else, we are just trying to calm, right? We are just trying to ground folks. We are just trying to lower distress, to lower big volume, because that's going to help the outcomes of any behavior that's happening. Should I do like the 7 jumps again for me? Yep. So, of course, everybody wants to talk about crisis, which is important, right? Because it's thinking about, like, hey, what gets us to this point where we are in crisis? Obviously, there's a lot more within this whole section, right? We're not even going into all the management tools tonight, all the field responses, all the treatments, even all the ways, right? We can use root or psych first aid or the wilderness medicine overlay or biceps, right, within those spaces. But, right, at some point we tend to recognize that sometimes we get to crisis. I like to think about crisis right on this 5-point spectrum, right? When I'm thinking about behavioral health crisis, I'm starting at like the exhaustion slash overload, right? That's step one. And within all of this, right, the things that are really going to change people's behavior to the point where like they're likely to become a danger to themselves or others, which is usually right what we use as like a clinical criteria of like, hey, we really need something to change, which tends to happen right around disassociation or psychosis, because that tends to be when folks disconnect from tangible reality. When folks are disconnected from tangible reality, they're more unpredictable, right? That creates danger for themselves, that creates potential danger for others, right? Suicide, self harm, right? Those are obviously danger to themselves. Abuse, harm to others, and homicide. And abuse, especially, we have very obviously ingrained into our society. And so it's something that often gets overlooked, but can have a really big impact, right, on folks and really shows up for others. Harm on others in general, right, can be something that starts to happen. And obviously homicide, big deal. And then panic and stress, right? So panic and stress reactions can get to the point where, yeah, our brains are no longer able to make decisions in ways that are safe for ourselves or for others. So the first step of that tends to look like exhaustion and overload. So, right, things like I want the pain to stop, burnt out, numb, right? They're still oriented, they're meeting basic needs, but they might be picking fights, right? They might be isolating, they might be starting to panic, right? Like that's when those physical symptoms can sort of start to show up, right? This is often the greatest place to intervene, just like anything else, right? The earlier on the spectrum we start supporting folks, right? We start calming things, we start centering, we start grounding, we start rooting, the better. Um, then we start to go up to the second level, right? This is when we're thinking about thoughts of death and harm, right? So this is when we're thinking passively about those things, right? Like that escape thinking is how I like to think about it. Like, oh my gosh, this is just so overwhelming, so hard. I just wish I could go to sleep and not wake up again, right? Yeah, that's concerning for sure. And that's not my like fifth level of continuing crisis, right? Um, that's when we're really starting to like our basic safety is still there, but like often starting needing support, right? We're like our panic is like having physical manifestations, right? This is when it's like that harm is becoming more possible, that those thoughts are becoming more like tangible, although there is no like, hey, I want this to happen, right? There's no intent that. As we start to move to level 3, right, that's when those thoughts become more active, right? So that's when we are thinking, like, yeah, I want to die, right? Or I really do want to go find a way to cut myself or to hurt myself, which sometimes, right, with outdoor activities can be like, I'm going to go send the scariest thing I possibly can because, right, I don't care anymore. This is really common after PTSD and grief, right? Grief and loss, we tend to see, right? Those really risk taking behaviors. Um, that instability start to show up, right? Disorganized thinking. So, this is when we start thinking about that psychosis space, right? When folks are no longer, right, following tangible logic, right? So, that's the piece. And you'll hear me say like tangible a lot, right? Because it is real for them. And I always think that's important because fighting somebody that right is in those spaces not helpful. um but right for the tangible, right, that's the things we can look, touch, see, right, based in like scientific fact that's been studied and peer reviewed, those sorts of things, right? Hallucinations, paranoia is starting in this section, right? Safety is becoming unreliable, right? We can't quite count on it the same way. um Panic behaviors creating instability, right? This is when I'm getting to the point where, yeah, I'm starting to do some very different levels of intervention, right? This is when, like, hey, this is getting safety is really being compromised. You can't really manage this the same way, right? This is when we start thinking about like evacs or like changing things at much like quicker levels, right? Because a lot of the twos, right, is sort of a depends on how you know them, right? Because a lot of folks, especially in 2026, have the like exhausted passive thoughts of death. And sometimes going hiking with them is actually really healthy for them, right? Because that's actually getting them outside and getting them that like time with friends, time outdoors, time movement, all the beautiful, happy things. That's really different, right? Maybe than if I'm leading a group of kids in the woods for 10 days who I don't know, right? So context matters. Um, then we get up to right like stage 4. This is when like they are now a danger to others and themselves, right? So like this is when we're talking about like clear suicidal plans, right? They want to die and they have a plan for how they want to do it. This is when that like severe psychosis or paranoia is happening, right? They're pretty disconnected from where we are in time, where we are in space. Coming into hallucinations, right? So someone's telling them to do things. Um, Grave disability, right? They're no longer maintaining their basic needs in this space. This is when like homicidal plans, they have plans, right? There is active abuse and harm happening, right? They cannot maintain safety. Obviously, at this point, right, we're moving things quickly to get more and higher levels of care than we can in the outdoors. But, right, sometimes we are in these spaces with them for a long time. So, thinking about these and having protocols of like, hey, if I'm with somebody that's actively suicidal and has a plan, what is that plan? What am I doing to right, help remove those ways and means of them accessing that plan, right? If I don't and can't get them help for a while. Same with like if someone's being abusive and harmful, right? How am I separating them? Those sorts of pieces. And then, right, we get to the 5th level of this, which is like imminent danger. And this, right, is when it's like, okay, I actively usually need to be intervening, slash getting them higher levels of care, right? Right. That's like when we look at suicide and like they have intent. they have a plan and they have means, right? So they are standing on the side of the bridge. That's sort of that difference, right? These are command hallucinations to harm, right? So the hallucinations are telling them to go harm themselves or others, right? That's that imminent danger, right? If a command hallucination is telling them to dance in the field, dangerous. We want to get them help. Very different than it's telling them to go kill somebody, right? Um, this is also right when we get that like extended frozen or unable to function. So sometimes folks go into catatonia, those sorts of pieces where they are no longer, right? They've totally disconnected for stress reasons and different like emotional reasons that we might not always have the answers to. Um, right? These are immediate life threatening things, just like any other immediate life threatening things. We're doing what we can to mitigate those spaces. And obviously, each of these have protocols that can be learned. Again, there's lots more. But right, these are sort of the continuum that we see within that. And getting comfortable along that continuum, I think, is really important because often, right, what I see is someone says, like, oh, I want to die and just like not wake up tomorrow. And yeah, that sounds scary and needs to be taken seriously, right? But it's also very different than somebody that's like walking to a bridge and like going to jump off that bridge and wants to die, right? Like there are very different pieces of like how we're going to intervene and how we're going to support them. But, right, that takes some practice and just like understanding and spending some time getting and thinking about these. Because I love that it just wants to like pause every time I try to click forward. I thought there was one. There it is. Context matters. And I think this is one of the harder parts about behavioral health, right? It's just so much of all of this really depends on the context. And a situation is going to be very different. And it's like where we can set up protocols, we can set up those pieces, but also there's just a lot of factors with humans and behavior. And so spending some time really thinking about that, right? Getting a little uncomfortable about like, hey, what parts of this make you uncomfortable, right? What parts do you feel like you don't have the information and need more information on? Right? Like that, where do you want to like build some of those protocols, those tools, trying out some of the different pathways and saying, like, does that actually work for me? Is that actually helpful? And then, yeah, thinking about like, hey, it's very different, right? If I'm like out on a trip and I'm leading and guiding a group of people versus if I'm out with my friends and family, right? If I'm out with one person versus if I'm out with 12, right? If I'm out with people that are all way better at me than the activity, or if I'm the one that's the best at the activity, right? There's so many pieces of this context. And that doesn't even talk about, right, the social context, right, of like our gender norms, right, our power hierarchies, our race norms, all of those pieces constantly at play, which is where I just reinforce understanding behavioral health is so important, right, for so many reasons, because it really does have such an impact for us, and we see it all the time. And right, there is just multiple different levels and understanding that's really important to get us that good, like comprehensive level of, hey, what are we doing when we think about backcountry behavioral health, right? It's not just one little, hey, we're going to think about the psych piece when someone is like in acute crisis, right? There's a lot more to it. And we owe it to ourselves and to everyone else, right? That we think about those things because we can do a lot of good for ourselves and others because going outside is actually great for us. And so within that, right, I like to just sort of think about it as like these three distinct pieces, right? And so thinking about it for yourself of like, hey, where can you learn more, right? How well do you feel like you understand the terrain, right? How understand people's behavior and what's happening there, right? How well do you feel like you've mapped the mind? Do you know conditions, behaviors, all of those sorts of pieces? And yeah, like how are good do you feel like you can navigate different storms, right? Across that intervention stream and cycle. Um, and so with that, I like to say thank you to you all and happy to answer any questions that you have, because I know that was fast and fierce um, and also a very high overview.
I got a question about, can you hear me okay?
Yep.
I have a question about if you're on a team as a wilderness provider,
Hmm.
what are some good pharmacologic agents to carry in your kit just planning for having to manage those unforeseen events in behavioral health? What are things that would work for other things like seizure meds or things you could bring that would be easy to carry and administer?
Yeah, I think it sort of depends on what level kit you're carrying. Um, but I like to think about things that will calm people down, right? So things like often people have like, we think about sleep meds and sleep aid, right? Like making sure folks sleep is often a really helpful thing, right? Of like if someone's feeling panicky or like excited, right, for whatever reason. And so things like Difen can double, right, as a sleep aid and a also like right an anaphylactic support for folks and allergies. So things like that, I think thinking about like, hey, what are medications, right, that can have that dual space for folks of
Yeah,
like, hey, this does that calming effect. Um, Obviously, it like the piece that matters within there is understanding, right, like what are the effects of if they're on psych meds, like how those different pieces interact, right, and that can be sort of the biggest factor. Um, is I would say because right we don't want to like some folks can become really hypo or hyper really quickly depending on what they're already taking, especially if they're on like antipsychotics or some of the different like really intense I would say like OCD treatments and anxiety meds. Obviously those are going to be more impactful for folks, but I think right like some things like anything that really can help folks find that calm and just brings like sleepiness down tends to be a helpful additive for folks in right really intense situations, right? It's kind of that idea of like anything that's going to help folks ground and root with the caveat, right, of like what else are they on?
yeah.
Sort of similar though, right? When we ask her like, hey, are you on Viagra? Same ideas, right?
Cool. Thank you.
Hmm. I also like to ask them what do they have. That's another piece I would add to that. A lot of folks, especially if they have it, like often have like Xanax in their stuff. So asking them what they have, or like if they have ADHD, they often have a stimulant. So asking them what they have can be really helpful too, because they'll often forget about it when they're in their like high space, and then they'll be like, "Oh, actually, like I have propanol or whatever else." So um, that's often a thing where they'll forget to say that, especially if you ask them like, "Hey, are you on any medications?" Especially if they just take it as needed for a psych med, some folks like forget that that's part of like their repertoire. They'll be like, "Oh no, I'm not taking anything for like heart attacks." They're like those sorts of pieces. But oh right, I do like carry Xanax, so that if I have a panic attack, I can take it. So asking is also often I find people carry stuff. Any other questions or things I can talk more about? We do have some more minutes, so I'm happy to dive deeper if you wanted more information about a specific thing.
Callie, do you feel comfortable sharing if you've had any experiences with like actual like intervention, like an example maybe? Um, I'm just like curious to see like to hear your thought process through like a situation.
Yeah, oh yeah, quite a bit. I think one of them that I see a lot is on the like anxiety piece, right? And the panic. So the piece around when folks are like, yeah, doing an activity and then get activated, right? Whether that's from, oh, this seems scarier than I thought it was, or right, they like are really tired and things go up. And I think within that, right, my like thought process is first trying to understand, right, what's happening with them, right? Like going of like thinking about who are they, right? What is happening, right? It's really that like recognizing, are we at 4 o'clock in the afternoon? Are we at 7 a.m., right? Like, did they just take their meds? Did they just eat? Did they just sleep? Or, right, is it way after that? Things like that, right? Observing their behaviors, right? Like, hey, are they showing physical symptoms of what's happening, right? Or is it just they're talking a lot, right? That can tell me a lot about like, hey, what is happening for them and to what level, right? And it very much depends on like how much interaction have I had with them, right? Like if I know them well, I'm like, oh, this isn't their baseline. If I know them less well, right? What is the baseline I know them at? And then how is that off, right? And then comparing that with what I know about other spaces and people, right? Um, and then I think within that, like whenever I'm intervening with folks, like behavioral health, right? It's low on that totem pole of good and bad, right? It's totally fine if you have certain physical health issues, right? Like, oh, you just broke your arm. That's kind of cool, right? It can almost be celebrated. Like you were doing that rad trick and now you're celebrated, right? Oh, someone's having a behavioral health reaction, right? Like that can be like stigmatized really quickly. So I tend to try to intervene with folks in like pretty private ways, right? So then checking in with them around like, hey, how you doing? Just wanted to check in, see what's happening for you, right? And get what information from them I can, right? Start a conversation, ask them questions as I think about that intervention space, right? And then based on what I'm getting there and what information I am, that's sort of how I'm like triaging, okay, like what is in my repertoire that I can use next? And often, right, it's just about being human with people, of just like, hey, again, just trying to root them, just trying to calm them, right? Thinking about, okay, let's just pause, right? Like, let's take 5 minutes. And sometimes, right, especially if they're really worked up, I will make it about me instead of them, right? Because they're already really in their head. So I'm gonna be like, hey, I'm gonna sit down for 5 minutes, right? You wanna join me? Right? And that can be some like intervention tools that just like help take some of that stigma, take some of that pressure off, but also, right, get us doing the things that help calm us, right? Or like, hey, you know, I'm going to spend 5 minutes like writing out all the things I'm worried about, right? I'm on my phone, fine. Like we're going to use it to help like just dump the brain for a minute, right? Or, right, like I might just have them do like jumping jacks, right? Like high physical exertion can be really helpful. Or, we're skiing, so I'm just like, let's just splash some snow on our face, right? Or splash some cold water on our face, right? That can be really helpful. Or like, hey, I'm going to take 10 deep breaths. You want to join me? Um, those types of pieces, right? That can just sort of like help root us, right? Help ground us. And of course, then that's going to depend on it as we go up to like higher levels. Usually, like even right, if folks are on that crisis continuum, right? The calmer I am, the calmer and like more centered I am, the easier it is for them to, right, get there as well. Even when they're being like the most aggressive, right? The most like dangerous, the more calm I'm being usually really just helps them also like not go higher. Um, so I would say that's a really common one that I see. And then the other one I run into a lot, I would say, in the outdoor community is just like folks taking risks, right? Like right after they just lost a friend, right after like their mom just died, or right, like I do a lot of work with our like combat military community, and right, they go outside and like they are coping with some very serious trauma and PTSD. And like that's then showing up by like running harder stuff, doing like bigger things. Um, and so then just kind of checking in with them, watching them, sort of saying like, hey, what is my avenue to be able to approach this with you to like help, right, create those better situations. Obviously, we can't control everything and we certainly can't control people, but all those sorts of things are kind of coming into that context, right? And I think about that context, right? Of like when I know somebody is like military veteran, I think about I'm going to approach that very differently, understanding some of their training and just like how they've been taught to operate versus, right, like somebody that's been in therapy for 12 years, right? Like those often are going to be different approaches, and that's okay. And so, like, thinking about that too is a big part of my intervention of like, hey, who is this person, right? What is their context? And, right, how can I try to meet them there to just like root and ground things a little bit? And yeah, sometimes that means taking it on as like, oh, we're going to do this for the group, right? Or I'm going to do this for me as a way to like invite them in without, right, singling them out and making that like crisis or like acute thing bigger. Um, Other times, right, it is, yeah, more direct conversations, right? So I think if somebody is like suicidal or is psychotic, right, like I'm going to ask them pretty direct questions, right? Or like even homicidal, right? I want to know what their plan is, right? I want to know, are they just actively like thinking about death sometimes, or are they just exhausted, right? Are they like, I want to die, right? If somebody tells me I want to die, that's very different than somebody telling me, oh my gosh, I'm totally exhausted. I just want it to end and I just want to like take a long nap, right? Those two things are very different. So asking those questions, right, to get that sense of like, hey, what's happening? And being direct and clear, right, as we go up that like crisis concern, right, of the danger to themselves and others around like, yeah, if somebody's like we've been sort of dancing around it, asking those like more calm questions, and then they're like going to run a rapid that I'm really like I do not think they can do, and it's really dangerous, right? Then, and I've been watching them, make some mistakes, and there's pieces with that. That conversation is going to get much more direct, right? The closer we're getting to like, hey, I'm very concerned about this, right? Like these are the risks, these are the hazards that I'm seeing, right? Same with like, hey, what is your plan for suicide, right? Are you thinking about killing yourself? If they tell me, yeah, I have a plan, I'm going to go take these meds, I'm going to be like, what meds, right? Like, where are they, right? Asking those questions as part of that intervention. So there's a whole bunch of whole little pieces of them.
Thank you. That was helpful.
I also like to say one of the big interventions that I have for especially anybody in medicine is medicine is hard, and our schooling and our residency programs are horrific. And so also check in on yourselves, right? I think that's a really big piece of the behavioral health, right? I mean, we just did that study came out. I'm not sure if any of you have seen it yet. That is, they did a big healthcare, like PTSD and trauma study. And healthcare workers right now, we have higher rates of PTSD and trauma than returning or Afghanistan and Iraqi soldiers who were in combat. So, like, theirs is about 33%. And right now, healthcare workers is like upwards of 45%. And then in certain disciplines, right, is even higher than that. So, right, that's obviously going out with you into the backcountry. And, right, we know with like licenses and boards and certifications and all of that, right, like there is a lot around those pieces. And so often, right, the folks that I worry about most are my fellow healthcare friends because, right, there are so many pieces. So within that, I like to just say, like, hey, find behavioral health providers. There are those of us out there that get it. And, right, check in with yourself, right? Know where are you on this spectrum yourself? Like, hey, you know, what just happened for you this week, right? How exhausted are you? What are all the pieces coming together for you within that space? And, right, what are the like professional, like scary aspects that come into this too. And so I always like to add that piece too of like, that's part of this intervention, right? Is like also yourself, which again is where it can be different than like, yes, you sometimes have that femur fracture and the patient has a femur fracture, but always, right? When you watch something scary and something is like really intense, that's impacting you as well.
Any other questions? Like probably time for one more.
Awesome. Well, hearing none, unless somebody jumps on right now. Um, I'm always happy to chat more about this, and I talk about it a lot and do a lot of trainings on it. So if you all do have more questions, want to like learn more, lean more in, please reach out. Right? I love this topic and really want it to become more integrated in wilderness medicine. So reach out, happy to chat more, and there's so much more to learn.
Thank you so much for giving this lecture. We're so happy that you're, yeah. Okay.
Stoked to do it.
Yeah. Okay, absolutely. Stop the recording here. Okay.